Hi, I'm Dr. Johal, owner of Family Dental Center in Guelph, Ontario. I specialize in laser tongue tie releases, and I'm here to walk through the tongue tie questions that families ask me the most. What is a tongue tie? A tongue tie, medically known as ankylosing, occurs when the strip of tissue under the tongue, the lingual frenulum, is too tight, thick, or short, restricting the tongue's range of motion. This connective tissue tethers the tongue to the floor of the mouth, limiting its ability to move freely and perform essential functions like nursing, eating, speaking, and even breathing properly. How common are tongue ties? Tongue ties affect approximately 5 to 10% of the population, though some experts estimate it could be as high as 25% when including all variations of oral restrictions. Many cases go undiagnosed throughout life, with individuals adapting and compensating for the restriction without realizing the underlying cause of their difficulties. There are two different types of tongue ties, anterior and posterior. An anterior tongue tie is visible when you lift the tongue. You can see the tight band of tissue connecting the tongue to the floor of the mouth, sometimes extending close to or at the tip of the tongue. A posterior tongue tie is less obvious and located further back under the tongue. The tissue may be thick, short, or tight beneath the mucous membrane, making it harder to identify visually, but still significantly restricting tongue function. Posterior tongue ties can be just as problematic as anterior ties, affecting feeding, speech, and oral development. Now let's talk about a lip tie versus a buccal tie. What is a lip tie? A lip tie occurs when the frenulum tissue connecting the upper lip to the gum tissue is too tight or thick, preventing the upper lip from flanging outward properly. This can interfere with breastfeeding latch, cause gaps between the front teeth, contribute to tooth decay when food gets trapped, and affect speech development. What are buccal ties? Buccal ties are restrictive bands of tissue connecting the inside of the cheeks to the gums. While less commonly discussed, these restrictions can also impact feeding, oral hygiene, and overall oral function. They are often addressed during tongue and lip tie procedures when present. How is a tongue tie diagnosed? A comprehensive tongue tie assessment involves both structural and functional evaluation. A visual and physical examination includes assessing the appearance and attachment point of the frenulum, observing tongue elevation, extension, and lateral movement, checking for heart-shaped tongue or restricted tongue sweep, evaluating the lip tie and buccal tie presence, examining palate shape and dental development. What classification systems do you use? Several classification systems exist. The most comprehensive approach goes beyond simply measuring how far the tie extends forward and instead evaluates the functional impact on feeding, speech, breathing, and quality of life. At Family Dental Guelph, we use evidence-based assessment tools that consider both anatomy and function. This is an important one. Do all tongue ties need to be released? No, not necessarily. The decision to release a tongue tie is based on symptoms and functional limitations, not just the presence of a frenulum. If a baby is feeding well, gaining weight appropriately, and the mother is comfortable, watchful waiting may be appropriate. However, if there are nursing difficulties, feeding problems, speech delays, dental issues, or other symptoms affecting quality of life, treatment should be considered. What is a frenectomy/tongue tie release? A frenectomy is a procedure that releases the restrictive tissue under the tongue or lip, allowing for improved range of motion and function. At Family Dental Guelph, we use advanced laser technology to perform precise, effective releases with minimal discomfort and optimal healing. Why is laser treatment preferred over scissors? CO2 laser frenectomy offers significant advantages. Precision allows for complete release of all restrictive tissue layers, including deeper posterior ties that scissors may miss, minimal bleeding. The laser instantly cauterizes blood vessels, providing a virtually bloodless procedure. Reduced discomfort seals nerve endings, resulting in less post-procedure discomfort than cutting with scissors. Lower infection risk. The laser sterilizes as it cuts. Better healing creates more control controlled healing with less scar tissue formation. No stitches required. The laser creates a clean release without the need for sutures. Complete release. Allows visualization and removal of all layers of restriction, not just a snip at the surface. I'm also asked often, is the procedure painful? The procedure itself is very quick, typically 1 to 2 minutes for tongue tie, less than a minute for lip tie. We use appropriate numbing techniques, and most babies cry briefly during the procedure, more from being held still than from pain. Many babies nurse immediately afterward and comfort quickly. Older children and adults receive local anesthesia and typically report minimal discomfort. What are stretching exercises and why are they necessary? Stretching exercises prevent the tissue from reattaching or healing with restrictions. The mouth heals very quickly, and without proper stretching, the tissue can reattach or form scar tissue bands that recreate the restriction. These exercises involve gently lifting the tongue or lip to keep the release site open during healing. While they may seem uncomfortable to perform, they are essential for achieving lasting results. What should I do after the procedure? Immediate care includes nurse or feed your baby as soon as they're ready. Monitor for excessive bleeding. A small amount is normal. Provide comfort and stay calm. Babies pick up on parental anxiety. For the first 24 hours, keep the area clean. No special products needed. Begin stretching exercises as instructed. 4 to 6 times daily. Maintain normal feeding schedule. Use pain relief as needed. Acetaminophen for infants or children. And for the first 2 to 3 weeks, continue diligent stretching exercises. Monitor healing and watch for white or yellow healing tissue. Maintain oral hygiene. Attend follow-up appointment if scheduled. Another important question that I'm commonly asked is, what is bodywork and do we need it? Many tongue tie experts, including Dr. Baxter, Dr. Gahary, and Dr. Zaghi, strongly recommend bodywork, from chiropractors, craniosacral therapists, or physical therapists, as part of comprehensive tongue tie treatment. Babies with restricted tongues often develop compensatory tension patterns in the neck, jaw, and shoulders. Dr. Zaghi's research particularly emphasizes the fascial connection. The tongue is connected to a fascial plane called the deep front line that runs all the way down to the toes. This is why many patients report decreased tension throughout their entire body after tongue tie release, and why some children experience improvements in posture, gait, and whole body movement patterns. Body work before and after the procedure can release muscular and fascial tension, improve range of motion throughout the body, facilitate better feeding coordination, optimize treatment outcomes, support the body's adaptation to newfound tongue mobility. Why is a team approach important? Tongue tie treatment is most successful when multiple specialists work together. The providers that support a successful tongue tie release include pediatric dentists or ENTs. They perform the procedure and evaluates oral structures. Lactation consultants, aka IBCLCs, address feeding technique and breastfeeding management, bodywork specialists, release muscular restrictions and tension patterns. Speech-language pathologists help with articulation and oral motor skills. Occupational therapists addresses feeding and sensory issues. Myofunctional therapists retrain tongue posture and function for long-term success. At Family Dental Guelph, we work closely with local lactation consultants, chiropractors, and other specialists to provide comprehensive care. Can a tongue tie grow back or reattach? The frenulum itself doesn't grow back, but the tissue can reattach during healing if stretching exercises aren't performed properly. This is why diligent aftercare is essential. In rare cases, excessive scar tissue can form recreating restriction. If this occurs, revision may be necessary. Why choose Family Dental Center for a tongue tie treatment? As a tongue tie specialist, I, Dr. Johal, offer over 9 years of specialized experience in tongue tie diagnosis and treatment, advanced laser technology for precise, comfortable treatment, comprehensive functional assessments based on the latest research, not just looking at appearance, experience treating patients of all ages, from newborns to adults, collaborative approach working closely with IBCLCs, body workers, and therapists. Evidence-based protocols informed by leaders like Dr. Richard Baxter, Dr. Bobby Gahary, and Dr. Sarush Zaghi. Thorough follow-up care to ensure optimal outcomes. Commitment to education for patients and healthcare providers. What qualifications should I look for in a tongue tie treatment? Seek a provider who has specialized training in tongue tie assessment and release, not just general dental or medical training. Extensive experience performing laser frenectomy procedures. Understanding of functional anatomy and the impact on feeding, speech, and development. Commitment to comprehensive functional assessment, not just visual inspection. Willingness to work collaboratively with lactation consultants and other specialists. Emphasis on proper aftercare and follow-up. Evidence-based practice approach. The provider does not need to be a pediatric dentist specifically. Many highly skilled tongue tie providers are general dentists, ENTs, or other specialists who have pursued advanced training and developed expertise in this area through years of dedicated practice. Here are some important questions you should ask potential providers. How many tongue tie procedures have you performed? What assessment tools do you use? Do you release posterior tongue ties? What technique do you use? Laser versus scissors? What is your revision rate? Do you work with lactation consultants and other specialists? What does aftercare involve? Do you provide follow-up support? Another question parents often ask is tongue tie treatment evidence-based? Yes. A growing body of research supports tongue tie release for symptomatic patients. Studies have demonstrated improvements in breastfeeding outcomes and maternal nipple pain, infant weight gain and feeding efficiency, speech articulation and clarity, dental development and oral hygiene, sleep quality and breathing, quality of life for children and adults. While research continues to evolve, the clinical experience of thousands of providers and families confirms the life-changing benefits of appropriate tongue tie treatment. Is tongue tie release covered by insurance? Coverage varies by province and insurance plan. In Canada, some procedures may be covered under provincial health plans when performed by certain specialists. Private dental insurance companies may provide partial or full coverage. Medical justification, such as feeding difficulties and failure to thrive, may improve coverage likelihood. We can provide documentation for insurance submission. Contact our office for specific information about your situation and coverage options. What do experts say? The following tongue tie experts emphasize the critical importance of functional assessment and comprehensive treatment. Dr. Richard Baxter, a board-certified pediatric dentist and laser surgeon, emphasizes that tongue ties affect nursing, feeding, speech, sleep, and dental development throughout the lifespan. His book, Tongue Tied, is considered the definitive resource for parents and professionals. Dr. Bobby Gahary, a board-certified ENT and researcher, has treated over 15,000 patients and integrated nearly 100 research papers into his work. His studies have demonstrated significant improvements in breastfeeding outcomes following tongue tie release. Dr. Sarush Zaghi, an ENT and sleep surgeon at the Breathe Institute, is a Harvard Medical School graduate who completed his residency at UCLA and sleep surgery fellowship at Stanford. With over 97 peer-reviewed research publications, Dr. Zaghi is particularly focused on the impact of tethered oral tissues on maxillofacial development, upper airway resistance syndrome, and obstructive sleep apnea. His functional frenuloplasty approach integrates myofunctional therapy before, during, and after surgery, and emphasizes the connection between tongue restriction and whole-body fascia systems. The Breathe Institute has grown into a global network of over 3,000 airway-centered healthcare professionals. All three experts emphasize functional assessment over appearance alone and stress the importance of comprehensive treatment, including proper release technique, myofunctional therapy, and appropriate aftercare for optimal outcomes. Thank you for taking the time to learn more about tongue ties. At Family Dental Center, we're happy to support you and your family through this process and help you feel confident in the care you choose. For FAQs related to babies, children, and adults, be sure to check out the other videos in my tongue tie series.